On the medical watch, the emotional health of Chicago kids has suffered during the pandemic.
That's the finding of a new survey just published by Lurie Children's Hospital. Dr. Matthew Davis is the head of pediatrics at Lurie Children's, and he joins us now to talk about this study. Really interesting stuff. Thanks for being with us, Dr. Davis.
Good to be with you both this afternoon.
First of all, what are the top line findings as you surveyed Chicago families?
Well, we found nearly half of all parents said that their kids had more behavioral health concerns during the pandemic than before. And about 1/5 of parents said that they had difficulty getting behavioral health support for their kids when they sought it.
Okay, let's break down some of these numbers. It says here 23% of them had tantrums, 19% of them were clingy, 11% had nightmares, on and on, headaches, stomach pains. Long term, what do you think the impact would be on things like this? Because they seem minor, you know, as you look at them. Okay, so a child had nightmares, but what does that mean long term?
Good question, Lourdes, and we're concerned that these symptoms, which are in kids who probably don't have the words to describe how distressed they are, how upset they are, these are ways in which that emotional distress comes through for parents. They can recognize it that way and seek the help that their kids need, perhaps with their primary care provider or other resources in their communities. In terms of the long-term concerns, we're following that at Lurie Children's and with behavioral health providers across the city. We encourage parents who are concerned about their kids to seek care first with their kids' primary care providers in hopes of averting the long-term effects of what a traumatic experience this has been for so many families.
Well, for a lot of kids, I feel like a school counselor, a teacher may be one of the few people in their lives who not only would recognize some of these behavioral symptoms, but also perhaps have the tools to address it.
You're right, Ben. We do depend on schools, the teachers, the additional aides who might be in the classroom, other members of the school staff to recognize distress among kids. And that really hasn't been as easy or even available because of all the virtual education that our kids have been going through. So we're happy that some kids are starting to get back to school now, the appropriate protections in the school environments, because we rely on all the teamwork that happens in order to protect kids and detect when their distress is really coming through.
And at the beginning of this, you said very few parents are actually going out and seeking the help. Can you explain that a little bit more?
Well, about 1/5 of parents said although they had sought the help, they hadn't been able to find it.
Okay.
About 1/4 of parents said they had sought professional help for their kids, and they had found it in Chicago. One of the challenges that we know we're facing as a city, and we're not alone across the United States, is that we tend to have more primary care available than behavioral health care available.
Right.
And what that's meant is that, and we've been doing this at Lurie Children's, we've been helping the primary care providers in our area feel more comfortable managing these behavioral health concerns among kids.
Okay.
Dr. Matthew Davis from Lurie Children's Hospital, thank you so much. We appreciate it.
Good to be with you both.
All right, we'll talk soon. Thank you. Up next, legal